I'm going to wait a little bit so we have more attendees and participants.
Always fun to watch those participant numbers.
Exactly.
Up, right?
Okay. I think we are going to start. Welcome, everyone. Thank you so much for joining us today. This is a webinar that is thanks to the biological section at the Gerontological Society of America. Today I'm representing the biological section. I'm the chair of the biological section at the GSA. And I would like to tell you that thanks to the GSA and the biological section at the GSA, they allow us to give you or present this webinar to you, thinking that this will be very interesting and important to you to know about the training and career development at NIA. Also, I would like to tell you that if you, whatever you think this is great or we need a little more, let us know, because we are here to help you to understand your next step. So send us your the email or text message to Gina or to us, and we will do our best to help you. Before, I will also say thank you to Gina. She is the person that helped us to set up this webinar. And so Gina, thank you so much. We have been very, very grateful to work with you in preparing this webinar. Also, I would like to tell you that the speaker prefer all the Q&A to be at the end of the session. Please post your question in the Q&A section and not in the chat. And also, all the slides are going to be available to you after the presentation today. They're going to be in the GSA website, and if you just send us an email, we can send it to you. Okay, without further ado, I would like to introduce our speaker today, Dr. Maria Carranza and Jamie Lahvic are both from the NIH. They are from the Health Science Administration. From the Office of Strategic Extramural Program and NIH and National Institute of Aging. Dr. Maria Carranza is a training officer and Dr. Jamie Lahvic is a program officer. And I cannot tell you nothing else that they are expert in what they are going to talk today. So please take advantage of this webinar. Ask all the questions that you have if you are eligible, when the timing, everything. They are the expert on this. So Maria and Jamie, thank you so much. The floor is yours.
All right, thanks so much. Yeah, thank you, Gina and Viviana, for inviting us to speak today. We are excited to give you a general overview of the training and career development programs from the NIA. And so these are going to be the programs primarily for graduate students, postdocs, and early career faculty. And we do have quite a few of these programs. So I'm going to start with just showing you our overall portfolio of training programs at the NIA. As you can see, it's quite extensive, spanning a wide range of career trajectories and periods throughout your career. So today we're going to be giving you kind of a surface level introduction to a lot of these, and I expect you might want to go and find more information, and that's easy to do in a few different ways. So you can explore our website where you can learn about a lot of details about all of these different awards. You can sign up for our training newsletter that goes out just once a month and gives you reminders of upcoming deadlines and lets you know about any new awards or new policies that are important to be aware of. And if you have additional questions, you can email us at niatraining@mail.nih.gov. And Maria and I both have access to that email address. So if you send an email here, it comes to two real humans. It doesn't just go in a box somewhere. So feel free to reach out to us anytime you have a question. And then you can follow NIA as a whole on Twitter as well. And throughout the presentation today, we do have a bunch of links in these slides, so be sure to go ahead and grab the slides once they're available from the GSA website so you can explore more in depth. So I'm going to start out today by telling you about fellowship awards, as well as similar awards that function like a fellowship. And so these awards are typically for graduate students and postdocs. So your typical fellowship award is going to get awarded to your professor, the head of your lab, and it's going to provide you with a stipend to cover living expenses. It might cover tuition, especially for a graduate student award, and it will typically provide a small amount of institutional allowance, which can cover travel to conferences, perhaps health insurance, that type of thing. Typically, these fellowships have 3 due dates per year. So anytime that you're ready to apply, you can start to prepare your application. So the ones that you're most familiar with are the F30 series fellowships. And so these are available from all of the different institutes at NIH. And I'll tell you a little bit about those, and then I'll go into a little bit more detail about 2 NIA specific awards after that. So the F30 series fellowships, we have the F30 for MD, PhD, or other dual degree students. And we have the F31 for PhD students and the F32 for postdocs. And what I want to just emphasize today is that NIA funds several different F31s and F32s. And these differ in the research topics that they focus on. For instance, if you're focusing on Alzheimer's disease research or general neuroscience, you might be interested in these. And then some of them are specifically targeted at to improve diversity in biomedical science. So they're for folks who are from groups that are underrepresented at a national level in biomedical sciences. So check out our fellowship website to learn more about all of these individual awards. So the ones that you might not have heard as much about, first of all, the R36, which is an NIA Dissertation Award. So this award provides up to 2 years of funding, and the goal is to help you finish your PhD. So it's going to fund your stipend, and it does provide a pretty good chunk of research funding of up to $20,000 a year. This one is diversity targeted, so you do need to be from a group that is underrepresented in biomedical sciences. And one thing to watch out for here is that this award follows the pay lines for research projects, and that's a different pay line for the fellowships. So you may have heard that NIA has separate pay lines for Alzheimer's disease research and for general aging research. So especially if you don't fall in that Alzheimer's category, the research and the fellowships pay lines can be quite different. So you want to take a look at those and make sure that the R36 is really the best option for you. Another award that we are very excited to tell you about is the F99. So this is a pre-doctoral to postdoctoral transition award. So it actually provides 2 phases of funding. First, up to 2 years to help you finish your PhD, and then up to 4 years to fund your postdoc. So this is great if you're nearing the end of your PhD and you know you want to continue as a postdoc. It is useful if you're planning on applying for the F99 to have already identified your target postdoc lab, but that's not required. And another important point is the goal of this award is to keep folks studying aging and also to bring folks into aging. So even if your PhD hasn't focused on aging research, if you would like to focus on aging research for your postdoc, you're still eligible to apply for this F99. And then one thing to keep track of here is the F99 only has 1 due date per year. It's in October, so you are going to want to plan ahead and think about the timing, especially in relation to the end of your dissertation. And so I'll wrap up this section on fellowships with just a few general tips for applying to fellowship awards. First of all, the research that you propose in your award should be feasible, and that should be feasible considering both your career stage and the number of years of requested support, right? So an F32 postdoctoral fellowship application will look different than an F31 pre-doctoral fellowship application, and that's expected. Additionally, an F31 that's applying for 4 years of support should look different than an F31 that's asking for only 2 years of support. So make sure you're being reasonable in what you propose. So it should be feasible. It should also be personalized, especially in the career development and training section. So reviewers really want to see that you're being thoughtful in planning out your career development elements here, and that you're not just taking whatever courses are available to you at your university, but you're really thinking about what do you need to learn, what kind of training do you need to get to pursue your personal career goals. And then finally, for the R36 and the F99, because these are designed to help you finish your PhD, you should have a clear plan to finish your PhD to meet dissertation requirements, such as publishing a paper if that's a requirement at your institution. And you should make that plan clear in your application. All right, for the next section here, I'll talk about NIA Transition Awards. So these are awards that help you transition from a postdoctoral mentored research position into a faculty position. So they're typically available for postdocs, but they might also be available for folks who have equivalent positions, for instance, a research scientist, and in some cases, junior faculty that are non-independent. So for instance, clinical faculty are often eligible for these awards. And there's two primary transition awards available from the NIA. The K99 is the more well-known award, and then the K22 is NIA's specific award. So I first want to just give you a little comparison of these two awards. So first of all, eligibility. The K99 can be a little bit challenging because it has a tight eligibility limit. You can only have up to 4 years of postdoc experience by the time you apply for the award. The K22, on the other hand, is a bit more open. You can have between 2 to 8 years of postdoctoral experience. Then, assuming you're successful with your application, the K99 would provide you with 2 phases of funding: 2 years of postdoctoral funding, up to 2 years, and then up to 3 years of independent research funding in your own lab as a faculty member. The K22, on the other hand, it doesn't provide funding during that first phase. What it does, it gives you an approval letter, and at the time that you receive your approval letter, you then have up to 1 year to get a faculty job. And once you've got that faculty job, then your K22 award kicks in and you get 3 years of funding covering both salary and research. So a few other differences to think about here. The K99 is quite open in terms of eligibility. You don't need to be a US citizen or a permanent resident, while for the K22, you need to be either a citizen or a permanent resident of the US. Additionally, the amount of funding that they provide is quite different. So once you reach the R00 phase, the faculty phase, you're receiving up to $250,000 in direct costs, which you can distribute to your salary or to your research, as makes sense. For the K22 instead, you can receive up to $100,000 to go towards your salary, and then only up to $50,000 for research. So the K22 is going to provide you less overall research money, but it does have that more open eligibility timeline. So for some folks, the K22 is the better choice. And thinking about the K99, I just want to mention that NIA does fund several different K99 awards. Feel free to explore each of these in more detail, but do note that the majority of these awards, all 4 of these at the bottom, are diversity targeted. So if you're not a member of a group that's underrepresented in biomedical sciences, then you're going to want to be looking at this parent K99. You should also take a look at our website because we've recently posted some sample K99 applications. So I hope those will be very useful in preparing your applications. And finally, just some tips on writing a career transition award. The thing to keep in mind is it's all in the name. So this is a career transition award. So make sure you talk about your career. Writing the career development plan and developing a expert panel of advisors who are going to guide you through these early stages of your career. That's really just as important as the research plan, and the reviewers spend a lot of time thinking about this and talking about this in the review session. So make sure you put a lot of effort into that. Also, this is a transition award. So for both the K99 and the K22, you need to be describing the research that you plan to do on both sides of the award. So both the postdoctoral research that you plan to do in either the initial K99 phase or in that K22 approval year, and also the independent research that you plan to do. Once again, because this is a transition award, you really want to explain your plans for how you're going to transition to independence. So you'll want to plan for what elements of the postdoctoral research that you're doing are you going to be able to take with you into your own lab? And how are you going to set yourself apart from your postdoctoral mentor? And make sure both you and your own biosketch and career development plan, as well as your mentor in their sponsor statement, have a clearly aligned vision for this transition to independence. And finally, always apply early. You especially want to allow time for resubmission, which can take quite a bit of time. And now I will pass things on to my colleague, Maria Carranza, who is going to talk first about Mentored Career Development Awards.
Good afternoon, everyone. I'm happy to talk to you today first about the NIA Mentored Career Development Awards, which are typically for early career faculty and sometimes for postdocs. Next slide, please. So on this slide, we are showing you the variety of K awards or career development awards that are sponsored by the NIA. As you can see here, these awards do not only include the K99 and K22, which are career transition awards previously covered by Jamie, but these include the K01, K08, K23, K18, and K25 awards, as well as the K76 award, which is a little bit different, and we will talk about it more in a few slides. But in general, all career development awards share some common characteristics that are listed here. First of all, they all provide up to 5 years of funding. And in terms of salary, they all range between $75,000 and $100,000 in salary. And very importantly, they require you to dedicate 75% of your full-time effort to the K award experience. In terms of research support, these awards provide a range between $20,000 to $40,000 in research costs. And these awards are available to US citizens and permanent residents at the time of award. For many of these, you can apply as a postdoc, but the award itself may require you to hold a faculty position by the time of award. However, that faculty position may or may not be tenure track. Next slide, please. On this slide, we wanted to show you the names of the specific career development awards, as mentioned earlier. The K01 award is the most general, and all types of aging research are welcome as a K01 award. The K08 and K23 award are specific for clinician scientists, and they must be proposing translational and clinical research for the K08 and patient-oriented research for the K23 award. The K18 award is a special initiative that is rather new to NIA, and it's specific for individuals working on pain therapies. In addition, the K25 award is a mentored quantitative research development award, which has as a requirement that the investigator have a quantitative graduate degree. This means basic sciences like physics or engineering are welcome to apply to this award. And these individuals may or may not have had prior wet lab research background and may be wishing to enter the field of aging with their quantitative degree. So if this is you, we welcome you to contact us about this specific award. Next slide, please. In addition, we mentioned the K76 or Bison Award. This award is also specific for clinician scientists, but it has several other important requirements, such as that the scientist must have an early stage investigator status at the time of award. The clinician scientist must have already held faculty level research support, such as an R03, an R21, or other private funding as well. In addition, the application requires the applicant to show evidence of past leadership and commitment to future leadership in aging research. This could be having organized a series of conferences or being the president of a certain organization that promotes leadership in aging research. The budget is slightly different than the other K awards, and It covers up to $225,000 per year for both salary and research support. So the investigator is able to designate at whatever percentages of this amount is important for their research in the way that they would like. There are no limits specifically for the salary or the research support that may be covered as long as it's within this $225,000 cap in direct costs. In addition, the Bison Award allows the Bison Scholars to attend the annual Bison Scholars meeting that is hosted by AFAR, or the American Federation for Aging Research, which is a very important and crucial component of this award and the network that it provides to its scholars, its alumni, and its mentors. Next slide, please. So once again, some advice on applying for NIA Career Development Awards, and again, it's in the name. So career development. So the career development plan, as mentioned earlier, is extremely important and just as important as the research plan. So reviewers want to see that you have spent time really building a panel of experts that will be available to you so that you can accomplish, your research goals and your career development goals. In addition, reviewers want to make sure that you make it very easy for reviewers to understand your career accomplishments. So it's very important for you to put them in context. The reason for this is that K awards at NIA are reviewed by NIA special emphasis panels. So you do not have to select a specific study section for your award to be reviewed. It will be reviewed at NIA. And these NIA study sections are broad panels. They contain broad aging expertise. So it's really important that, for example, if you're a clinician scientist, you put your accomplishments in context for what that means for other clinician scientists, as it is surely different for what it means for a candidate with a PhD in a specific discipline. So please make it easy for reviewers to understand your career accomplishments. And again, reviewers want to see a very clear aging relevance. This seems intuitive, but it's really not. They really want to make sure that you have identified, where you are and where you want to be, and what is that gap that you need to fill in order to get to where you need to go, and what specific aging-related training you actually need to obtain, which could include formal coursework, workshops, etc., in order for you to attain that expertise that you want to obtain. Next. And now we're going to cover some important aspects of early career or early stage investigator funding programs at NIA, which are specific for early career faculty. Next. So first, two important definitions. The first definition is early stage investigator, or ESI. This is an investigator that has not received R01 or equivalent funding and who has completed their terminal research degree or clinical training within the past 10 years. And this ESI status will show in your ERA Commons account and will help you in the ways that we will tell you in just a moment. On the other hand, a new investigator is an individual who has not received R01 or equivalent funding, but who is outside or beyond that 10-year eligibility window for the ESI status. So this ESI status is really important, as we will explain in just a moment, but please know that extensions are available for this ESI status, and you may request those via ERA Commons. And reasons for these extensions can be childbirth, medical leave, COVID-19 related delays, etc. We encourage you to visit our website here at the bottom of this slide so that you can see what those extensions are and how you could potentially request one. In addition, it's important to know what are R01 equivalent awards. And here you can see a list of the type of awards that are considered large research program grants that once you obtain them, you will no longer be an early stage investigator award. Next slide. Why is knowing your status important? The reason for this is that applications from early stage and new investigators are among NIA's highest priorities. So as you can see here on this slide, you can compare the pay lines for both general and AD and ADRD aging research, and you can see how those pay lines are much better for new investigators and early stage investigators when compared to the overall pay line for research program grants. So knowing your status and most importantly, having an updated ESI status on your ERA Commons file will be very important so that you can be considered under these pay lines. Thank you very much. So one important award that is available to early stage investigators is the CATS ESI R01 grant, which you may have heard about. So this is a type of R01 that is available specifically for early stage investigators. So therefore, having your ESI status updated will make you eligible for this award. This funding opportunity is for innovative projects, and they must represent a change in research direction for the PI. So it's innovative. You must not have published in this area, for example. And most importantly, a requirement of the CATS ESI award is that no preliminary data is allowed and no preliminary data should exist. So this is very important because you may wish to think carefully whether this is the right opportunity for you as an ESI investigator, because your application will actually be administratively withdrawn if you include or even hint to the existence of preliminary data. How can you prove that something is not preliminary data? All the data that you present, including graphics, should be accompanied by the appropriate citation, meaning that it comes from published data that is publicly available and not from any unpublished data that you may have generated in order to deliver this proposal. So if you have any questions about the CATS ESI R01 award, please let us know. However, know that you can apply and respond to any R01 funding opportunity announcement. And if you are an ESI, you will be considered under the better pay lines that we mentioned earlier. So you don't have to apply for the CATS ESI in order to be considered like this. Next slide. As you move along your career and you start thinking about the research grants that you may wish to apply to, it's important that you realize some of the differences between the three most important research program grants that are available to you, and that you consider which may be right for you. And these three most commonly applied for research program grants are the R01 grants, the R21 exploratory or developmental grants, and the R03 small research grants. As you all know, R01s are the standard 5-year awards. There is no budget limit as long as it reflects the actual needs of the proposed project, but it usually goes to advanced or established investigators to fund their independent work. So before an individual applies for an R01 or in combination to applying for an R01, investigators may choose to apply for an R21 or an R03. An R21 is a smaller risk 2-year award that has $200,000 in direct costs per year, and it does not require preliminary data, although preliminary data may be included. In addition, there's the R03 small research grants, which provide between $50,000 to $100,000 in direct costs per year for up to 2 years. And this is the type of award that will allow you to conduct pilot research that is likely to lead to a subsequent individual R01 award. So we encourage you to visit our website here at the bottom of this slide so that you can see the NIA-specific funding opportunity announcements on these 3 categories that you see here that you may wish to apply to, in addition to the parent R01, R21, and R03 funding opportunities, which are always available to you. Next slide, please. Towards the end of our presentation, we wanted to make sure that we mentioned the Butler-Williams Scholars Program, which is a unique offering by NIA that provides opportunities for junior faculty and researchers new to the field of aging to gain insight about aging research. And it provides personalized attention and cohort networking and emphasis on capacity building. You can check a recent Butler-Williams blog post here on this slide. And usually applications are due in the spring and the program is in the summer. This year, the program will be completely virtual. To be eligible, you need a doctoral degree. And if you have any questions about the Butler-Williams Scholars Program, please feel free to direct it to the email address on this slide. So while applications are closed for this year, we encourage you to think early about your application for the Butler-Williams Scholars Program so that you can be ready for next spring if you're interested in applying. Next slide, please. In addition, we wanted to make sure to mention NIA's diversity and related supplements. It's important to note that these are not grants. These are administrative supplements to existing awards that will allow individuals to apply for funding. For example, the diversity supplements are geared towards enhancing the diversity of the research workforce by supporting investigators from underrepresented backgrounds. So individuals all the way from high school, undergraduate, through graduate, postdoctoral, and early career investigators may be supported through a diversity supplement from a parent research program grant. There's also the reentry and reintegration supplements, which support individuals with high potential to reenter or reintegrate into an active research career after an interruption. This also must be sponsored by an active research program grant. And in addition, we have the continuity and retention supplements, which are available to K awardees and to first-time R awardees. And these will provide support during critical life events to the recipients of these K and first-time R awards in order to minimize departures from the biomedical research workforce, as mentioned earlier, due to a critical life event. This could be childbirth, it could be taking care of an ailing spouse, child, or family member, and other eligible situations that you can check out on the notices here on this slide. Next slide, please. So to end our presentation, we want to make sure that we let you know the many ways that you can connect with the National Institute on Aging, as mentioned earlier by Jamie. Our website is very user-friendly and we invite you to browse as much as you want. We also have the NIA training email address that both Jamie and I will be happy to answer your questions through. We also want to make sure that you know that NIA has a blog and that you can subscribe to receive our blog to see our recent posts for early career investigators, all the way from graduate students to postdocs to faculty. We also invite you to subscribe to our newsletter to get monthly updates on NIA training. And then we also invite you to follow us on Twitter for up-to-date NIA research news. And with that, we will conclude this presentation and we will be happy to address your questions. Thank you very much.
All right. Well, I can start by reading you a couple of questions, Maria.
Sure.
So we have a lot of questions regarding eligibility. One is for a K award. Am I eligible to apply for a K award if I'm starting a faculty position in the fall, or do you need to still be a postdoc to be eligible for a K award?
So the answer is it depends on which K award you're planning to apply for. If you're planning to apply for a K99 or K22, then you must be a postdoc or in a position that is still non-independent and mentored. However, for a K01, which would be the award that I would recommend to you, you actually are required to have a faculty position at the time of award. So if you're starting a faculty position, then this is exactly the award for you. If you have additional questions, please reach out to us.
And then a related question for the K99 or K22 awards. When we say 4 years eligibility K99, is that you must already have that many, or is that your maximum amount of experience?
4 years is the maximum amount of postdoctoral experience that you can have to be eligible for a K99 award, meaning that you must be within your first and third year of your postdoctoral experience overall in order to be eligible at the time of application.
Right. And here's a good one that I don't hear too often. What is the right timing to inquire about an eligibility extension? How long before a due date should we ask about a potential eligibility extension?
As soon as possible. While the funding opportunity announcement requires you to inquire, I believe, at least 12 weeks or 3 months before you apply, honestly, we are happy to let you know about your eligibility and a potential extension as soon as you inquire with us. So as soon as possible.
All right, and here we've got two related questions about sending in multiple applications pretty soon, one after another. So one question would be, could you apply for the F-32 in the late summer and fall, and then also apply for the K-99 for the October 12th due date? And then a related question, could you apply at the same time for instance, the K-99 as well as for an RO3 award?
Jamie, do you want to address that question?
I can take that one. Yes, so the NIH does have a policy regarding overlap. And so you cannot have two applications under review at the same time that have overlapping specific aims. So for instance, if you were to send in that F-32 application, if you're able to then write a K-99 application that is totally separate from your F-32 and does not have overlapping specific aims, in that case, you could send them both in. I think for most scientists, they have one major project that they are working on, right? So you could not write a similar or overlapping application for the K-99 right away. So what does under review mean? So the NIH considers your application to be under review up until the point that you receive a score and receive your summary statement back from the review committee. So keep an eye on your ERA comments. Once you get that summary statement in, then you can make your decision about, should I resubmit this award? Should I consider going after a different award? And that's a great time to talk to your program officer so that they can give you, specific advice about what to do next.
Thank you. But then, of course, if you have two completely separate ideas, that you want to submit 2 RO3s for, or 2 different types of awards for, then you are, of course, welcome. They should just not be overlapping in any way.
All right, let me see. We've got a lot of questions. Let me see if there's any that are especially relevant. Yeah, how would somebody decide between, for instance, the K01, K08, and the K23? Since a lot of folks are eligible for all 3.
Sure. Well, clinician scientists, that is dual degree individuals that may have an MD, PhD, DDS, PhD, they typically opt for the K08 and K23 because the K08 and K23 are specific. It's a requirement that you must have a clinical degree, a clinical dual degree. So those 2 awards are for clinician scientists, whereas people with a PhD may choose to go for the K01 award. Remember also that there's a difference in the type of research that you can propose. So not only your degree, but the research that you can propose. The K01 is the most general one. And clinician scientists are eligible for the K01, but they may choose to also apply for the K08 and K23. But for the K08 and K23, it's clinical translational research for the K08 only, and patient-oriented research for the K23 only. So it really depends on your type of research and your degree.
Absolutely. And then here's a great question that I want to give an answer to in the chat. So someone asked about, is there a breakdown on an NIA or NIH website regarding how many applications get submitted for an award, how many get funded, that sort of thing. And there is. You can find this at the website that I've just put in the chat. You can also find it pretty easily if you Google NIH success rates. And that'll take you to a page that covers NIH success rates very broadly. So it divides them between research project grants. So if you're thinking about, for instance, the CATS ESI, that's an R01, or if you're thinking about the R03, R21, those are all going to fall under research project grants. And then the other option is training and research career development programs. So these various F and K programs that we've told you about, they're going to be under the career development and training programs. And then what you can get on this website is a very large Excel file that shows you different success rates for different awards across different years. So you'll want to sort by the particular award that you're interested in. And I think it's important to, it's like someone says she doesn't, oh, okay, I think I wrote it to just the hosts. Let me make sure the link comes through for everybody. Thank you, Tanya. There you go. So what you want to make sure you also sort for is NIA, if you're applying to NIA, or another NIH institute, if you're applying to that NIH institute, because the success rate will be different for all of the different institutes. So I think looking at success rates is very informative. You can then also look at the pay lines, which will tell you how good of a score are you going to need to get in order to be paid. So I mentioned, for instance, that the R36 has a very different pay line than the F31. So graduate students who are often eligible for both will want to think about that when they make that decision.
Thank you, Jamie. That's a very, very thorough response.
Sure. Yeah. Let's see, what else have we got here? Oh, here's one more that I wanted to answer. A question about K99 and the 4-year eligibility limit. This person asked, let's say you submitted your K99 in year 4 and you got a pretty good score. Can you now do a resubmission in year 5? And the answer is unfortunately no. That K99 4-year limit applies both to your initial submission and your resubmission. So when we say you should plan ahead and apply early, we really mean that. You should apply very early and leave enough time for that resubmission. And once again, you might run into this overlapping aims problem, right? So you can't apply, for instance, in this upcoming cycle for this June, and then immediately do a resubmission next October, because you won't, by that point, have received your summary statement from your initial application. So you need to wait to receive your review, which will typically require 2 cycles. So you really want to be planning ahead for that.
So if I may, Jamie, there's a question about diversity supplements here, and it is, do you have to have a grant from the NIA in order to be eligible for the diversity and related supplements? So typically your mentor has to have an NIA award, which we call the parent grant, from which this supplement, which is an administrative or additional money that is added to that parent grant, comes from. Okay, so typically it's the mentor who has an R01 or other type of research program grant that must have at least 2 years left of active status at the time of application to be eligible. They will put forward an application on your behalf as the candidate, for example, and you as the candidate could be an undergraduate student, a graduate student, a postdoc, or even an early career investigator. And this application will propose for you a very detailed training and career development plan in addition to your research plan to be accomplished in 1 to 2 years. This is very important because different institutes at NIH have different award durations for diversity supplements, but at NIA, diversity supplements are 2 years or less. So you're basically proposing this training and career development plan along with your research plan to be accomplished in 1 to 2 years. So I'm going to put our website for diversity supplements in the chat in case you find that helpful. Thank you.
All right, let's see. It looks like we still have a little bit of time left, so we can still go for a few. We've got a lot more questions still. let's see. Here's one I don't know if you know off the top of your head, Maria, but it's do costs associated with training, for instance, attending a workshop, could those come from the research budget of a K-23 or a similar mentored K award, or is there a separate budget that could cover that?
Yes, they come from the other research-related costs, because remember, this is a career development award. So therefore, any costs associated with your career development, which could be courses, workshop, should come from that portion of the budget.
All right, and one for ESI awards. Can ESI awards be offered to a candidate who intends to conduct international research with data collection happening outside of the US?
Sure. Yes, all research program grants are allowed to have international components. So the answer is yes.
Great. Let's see, here's one for me, perhaps, for the dissertation awards, such as the R36 or the transition award, the F99. Is there a time frame that's best to apply, such as the end of your second year, or can these only be applied for after dissertation proposal has been approved? So for both of these awards, you do need to be in the dissertation phase by the time of award. So that typically means you have passed a qualifying exam, you've joined your dissertation laboratory, you're no longer doing rotations, for instance. And I know different PhD programs sort of have different timings for how that works. So when I think about timing for R36 and F99, I sort of count backwards from your graduation date, right? So they can each provide about 2 years of funding. So if you expect to graduate in year 5, and it can take about 9 months to receive an award, then yes, you probably want to be thinking about your application towards the end of your second year, maybe in your third year is the most typical timing. They do require you to be at the dissertation phase at the time of award. So if you're in a case where maybe your program does qualifying exams pretty late in your third year, for instance, you can still apply pre-qual and then include in your institutional letter a statement that you're expected to pass your qualifying exam and be at the dissertation phase by the time you receive your award.
Great. So there is a question here, Jamie, if I may. It's does the general ESI or do the general ESI applications require preliminary data? So it depends on the type of award you are planning to apply for. So typically R01 grants require, a good amount of preliminary data to prove the feasibility of your project, because these are the largest and most serious, commitments that NIH makes, to investigators. The only R01 grant that does not require preliminary data is the ESI, the CATS ESI R01 grant that we mentioned, for which not only is it not required, preliminary data should not exist. So you should be careful to not even hint to the existence of preliminary data for those. In addition, R03 small grants typically do not, typically are for you to develop the preliminary data so that you can then later apply for an R01. So while feasibility will always be a consideration in an R03 and any other award, you may not need a very large amount as you would need, for example, for an R01 award. So, and the same for career development awards. Again, feasibility will always be a question that reviewers will ask. So you need to demonstrate feasibility, but that could be a combination of data and literature and other types of sources that you can present a convincing case that the project you're proposing is feasible. So I would say it depends on the type of award that you are planning to apply for, and you're always welcome to send us your aims, a one-page overview of your aims. They don't have to be perfect or polished. Please treat them as a conversation starter. Send us your specific aims and the types of awards that you're interested in applying to, and we will be very happy to connect you with a program official with expertise in your area so that they can provide with additional guidance. Thank you.
I'm glad you said that. I think we typically try to say that during our presentation, but yes, send us your aims for anytime you're applying to an NIA career training or training or career development. Go ahead and send us your aims as soon as they're ready so that we can get you some feedback. Here's a good general question. Should you note a particular study section that you would like your application to be reviewed under? Do you have a response for that one, Maria?
Again, it depends on the type of award you're applying to, right? So fellowships at NIA are reviewed by standing study sections for the whole of NIH. So for fellowships, you do want to propose a few study sections that you think may be the most suitable for your specific research topic. If you're applying for a K award, you do not need to choose a specific study section because they will be directed to NIA, and NIA will review them at study sections within NIA that are specific for career development, so they will be routed to the right place. With research program grants, our grants, for those you do need to choose a specific study section, and the program official who provides feedback on your aims that you will send us can also make suggestions of the right study section that you can propose to review your award.
Here's one for me. Do K99 reviewers, do they prefer medical or biological and related disciplines? Or what about social science research? And the answer is at NIA, we are very broadly interested in aging. So that includes both basic underlying biology of aging, clinical research on how to care for aging patients, social and behavioral research on aging. And of course, we have a large interest in aging of the brain, neuroscience, and Alzheimer's disease. So all of these topics, we have K99s funded in them. I don't see any particular priority given by reviewers. I would reiterate one thing that Maria mentioned, which is that all of our K awards are reviewed within a study section that includes reviewers with expertise in the social and behavioral, in the biological, in the medical world. So you should expect that you might have a reviewer reading your application who comes from a very different background than you. And so, for instance, clinical applications often have many first author papers associated with them, whereas the basic biological applications typically do not have as many. So that's where putting your own personal career accomplishments in context for the reviewers is going to be really helpful.
Okay. So there is a question about the Bison Awards that I will take. So it's a two-part question. The first part is for the Bison K76 Career Development Award. It requires recipients to have prior funding. The answer is yes. And the question is, does Veterans Affairs funding count? Yes, absolutely. NIH, other federal agencies, and even private funding counts as that prior funding that a K76 applicant may have. The next part of the question is for the CATS award, how substantial a change in direction is required? Substantial is the answer. Yes, so it can be related, but you may not have published or spent, a very significant portion of your time and effort in that area. And also change in research direction is a review criteria, not an eligibility criteria. So it will be up to the reviewers and up to the applicant to have, proposed or provided a convincing, compelling, argument as to why this is a large enough change in research direction for you in your particular context. So please pay attention to that. And we're happy to discuss further privately if you need to. Thank you.
Yeah, we have one person who's interested in a recent NOC related to administrative supplements to T32 training grants. And so the T32 is an institutional training grant award that would go to a university. So today we've been talking about individual awards. So we'd be happy to answer your questions about institutional awards, but feel free to send us an email directly. Here's another one for you, Maria. For a clinician scholar awards, do you need to be currently practicing in the clinic and doing research? So for interest, if you have your nurse's license or if you have an MD, but you're not currently doing clinical work, are you still eligible?
The answer is yes. You must be licensed in the US to conduct clinical practice. Whether or not you're doing it at the moment is a separate thing. So you have to have your clinical degree and you must be licensed to conduct clinical work. Is what makes you eligible for a Clinical K award. Thank you.
All right, well, it looks like we have 2 more questions and maybe just enough time to answer them. So here, I'll start with one for you, Maria. So if there's an FOA for an R01, for instance, indicating a priority funding area or a notice of special interest in a particular area, would there also be prioritization for K99 applications or other mentored K applications responsive to that priority funding area?
So perhaps not necessarily prioritization, but K99 and K applications in those areas are welcome. So feel free to submit aims or an application in that particular area, even if the notice does not apply to K awards. That research will still be welcomed, and you may actually have a person that you can contact, through that FOA or that notice that you can, provide those aims for feedback even before you submit your application. So you're welcome to apply in those areas, even if it's not an express priority at the K level.
Let's see, and we have a question about sort of combining a K99 and K22 submission. So can the reviews that you receive from a K99 submission be useful in then submitting a K22? For instance, if your K99 wasn't funded and you've now sort of aged out of the K99 and so you're hoping to try for the K22, can you use the feedback from your K99 to help structure your K22? I think it would be a great idea to do that. You won't be submitting a true resubmission, so you won't be able to provide the resubmission style letter in response to the reviewers to sort of go through it point by point. But many reviewers, the K22 and the K99 are reviewed by overlapping sets of reviewers, so some of them might have seen your application before, and certainly the feedback that they provided you on that original K99 is hopefully good and useful feedback that you should take into account as you plan your next application. Okay, I think we might be done. Do we have any other questions?
Yes, I'm going to echo what I'm seeing in the screen. Thank you so much, Maria and Jamie. This I think, has been very helpful even for me. And please, to all the participants, if you have any other question, don't hesitate to contact Maria or Jamie. They are going to answer you very, very soon, because I'm a witness of that. So without anything else, and thank you all of you for joining us. I think we complete this webinar. It's already 3 p.m. And again, thank you to all of you. And Maria, Jamie, so many thank you. You have been great. If you have any questions, if you have anything to add, to contact us, please send us an email, contact Gina, contact the GSA, and we will be happy to answer all your questions. And we are open to any critiques, okay? Thank you so much.
All right,
Thank you, everyone. Bye-bye.